What is prostate? The prostate is a walnut-sized gland located just below the bladder, in the front of the intestines, surrounding the outlet of the bladder. The main function of the prostate, which is a part of the male reproductive system, is to produce the fluid that protects the sperm and to store the sperm in this fluid in a healthy way. In addition, it tightens the mouth of the bladder and prevents urinary incontinence. There are three most common forms of prostate disease. Inflammation of the prostate, prostatitis, is a non-cancerous enlargement of the prostate, benign prostatic hyperplasia, or BPH, and prostate cancer. A man may experience one or more of these conditions. These diseases may occur with different symptoms. What are the prostate symptoms? As you get older, the prostate grows and begins to compress the urinary ducts passing through it. The organ that enables urination is the urinary bladder and has a structure made up of muscles. Although the prostate compresses the urinary tract, in response to this situation, the muscles of the bladder expand and the bladder begins to contract more strongly. At these stages, the patient may have no complaints, or as time passes, the prostate continues to grow and fatigue occurs in the bladder muscles. In this case, the patient's urine flow slows down, interrupted urination, dribbling during urination, intermittent urination, and the feeling of urine still inside after urinating occur. Prostate symptoms that begin with prostate enlargement are frequent desire to urinate, pain, burning, or bleeding when urinating, intermittent or little urination due to prostate, urine dripping continues after urination, increased need to urinate, especially at night, feeling that the bladder is not fully emptied, sudden need to urinate, urinary incontinence, sexual dysfunction. Why does prostate enlarge? One of the reasons for the enlargement of the prostate is old age, and the other is known as the stimulating effect of the male hormone, testosterone, and estrogen. Genetic predisposition is among the causes of prostate enlargement. In men, the prostate enlarges, doubles, during early puberty. After the age of 25, the prostate grows in all men in different ways. The prostate gland begins to grow in men in their 30s and continues until the end of life. While half of men over the age of 50 have an enlarged prostate, this rate increases to 65% after the age of 60. By the age of 80, the growth rate exceeds 90%. A significant portion of these patients are followed up with medication or surgery. What is prostate biopsy? How to? In standard prostate biopsy, the prostate capsule part, peripheral zone, is divided into 12 regions, and a random piece is taken from each region. The ultrasound device cannot distinguish between normal prostate tissue and cancerous tissue. So suspicious areas cannot be targeted for biopsy. Random samples are taken from different areas of the prostate, and it is hoped that tumor tissue will be encountered. These random biopsies sometimes fail to detect cancers that have the potential to progress rapidly. In new types of MRI fusion biopsies, the patient first undergoes a special prostate MRI. Then, suspicious areas for prostate cancer are determined on MRI and marked digitally. These images are uploaded to special ultrasound devices, and prostate biopsies are taken especially from the areas indicated by MRI. Since MRI shows very well aggressive cancers in the prostate, especially those larger than 0.5 cc, life-threatening prostate cancers are not missed with this method. How to diagnose prostate diseases? The diagnosis of prostate enlargement is made through blood and urine tests, ultrasonography, and urine flow tests, which do not disturb the patient in any way. A treatment plan is applied according to the degree of growth detected in the person and the complaints caused by the patient. How is prostate treatment done? Benign prostatic hyperplasia is treated with lifestyle changes, patient monitoring, medication, and surgery. Since the prostate is an organ that naturally grows with age, it is not possible to prevent this. However, during this period, treatments are applied that minimize the patient's complaints and improve the quality of life. Usually, first adjustments are made regarding the patient's toilet habits and lifestyle. If necessary, drug treatment can be started as a second step. Drug treatment for prostate enlargement is applied to reduce patients' complaints. The drugs called alpha blockers are the most commonly used drug treatments and provide the quickest relief from the blockage caused by the prostate. In recent years, there are types of these drugs with very low side effect profiles. Apart from this, there is a group called 5-alpha reductase inhibitors that stop the growth of the prostate and reduce its size in patients with a prostate size over 35 grams. The effectiveness of these drugs begins after 9 months of regular use. If the patient goes to the toilet frequently and is diagnosed with overactive bladder, then anticholinergic group drugs are added to the treatment. In recent years, it has been proven that the phosphodiesterase 5 inhibitor group of drugs effective on erection can regulate urination complaints with regular use. In patients who do not receive treatment, wasting of the bladder muscles occurs, and the high pressure in the bladder begins to damage the kidneys. Even if treatment is received after this stage, bladder and kidney functions often do not return to their previous state. Prostate surgeries for prostate enlargement can be grouped under 2 main headings. The first of these is the surgery in which the prostate is cut from the inside by entering through the urinary tract. The most well-known is the TUR procedure. In TUR surgery, the growing part of the prostate is cut and removed using an electric wire at the tip of the instrument. Since the electrical energy used in classical TUR surgery may have side effects on erectile functions, today different energies called bipolar or plasmakinetic are used in TUR surgeries. There are also laser methods that are performed through the urinary canal and vaporize the prostate. In these techniques, different energy sources such as green light or diode laser are used. Also, for large prostates, the holmium enucleation method can be mentioned, in which the prostate is peeled as if peeling an orange by entering through the urinary canal. The second main topic is prostate enlargement surgeries performed through abdominal entry. These are open prostatectomy, laparoscopic simple prostatectomy, and robotic simple prostatectomy surgeries. In surgeries performed through the abdomen, the urinary bladder is also cut in addition to the prostate, and bleeding may be greater than in surgeries performed through the urinary tract. Therefore, this type of surgery is not preferred unless absolutely necessary.